Hello, and welcome to the Department of Drug and Alcohol Programs Warm Handoff Survey Webinar Update for November 2021. Any questions about this webinar can be submitted to the resource account that will be given at the end of the webinar. This webinar is on the current Warm Handoff survey platform that SCAs have been successfully using since April 2020. This webinar was designed internally by DDAP staff as a form of technical assistance to facilitate a smooth transition for the upcoming enhancements for the survey. This training includes full survey instructions that will be useful to any new staff filling out the Warm Handoff survey, along with the changes to the survey platform. The changes to the Warm Handoff survey will go into effect with the February 2022 survey link. The SCAs will most likely need to make changes to their data process to ensure the data they are collecting will match for the data now being requested in the survey. The SCAs will need to be prepared to start this new process in January 2022. This means that you may begin collecting and preparing to report this data in January 2022. In addition, you will not need to download anything new for these changes. The survey changes will automatically show up when you click on the link that we send you in February 2022. Now, I will turn over the training to Ralph Beischlein, who provides statistical support for DDAP. Ralph will guide you through the next steps of the survey enhancements.
Thanks, Amy, and my thanks to all those attending today. I am going to briefly walk you through the DDAP Warm Handoff Survey 123 for ArcGIS form. After completion of this training session, if you have concerns, please submit your questions to the DDAP resource account provided at the end of this presentation. The monthly Warm Handoff data collection process begins with the dissemination of the monthly survey form links by DDAP. Upon opening the link from DDAP, you will be brought to the starting screen of the form, and you are ready to start data entry of your Warm Handoff data. When completing the form, you will be asked a series of questions. Some of the questions may require you to select your response from drop-down boxes, make your selection from the list of options provided, or you may be required to type your own response. Your responses to questions may cause additional questions to appear. The form responds to your answers and is updated in real time. Questions requiring a response to the form are denoted with a red asterisk. Most questions in this collection form are required. Start your data entry by selecting your SCA from the drop-down list. This selection populates information on the rest of the form for your SCA based on what was initially provided in collaboration between DDAP and the PA Department of Health, Division of Acute and Ambulatory Care Department, and further refined through submitted clarifications, additions, and removals for hospitals with emergency departments in the SCAs. The date field will automatically populate and is set to a read-only status, so you'll be unable to change it. This value will change each month as I produce the latest form, so please verify that you are reporting data for the correct period when completing the form. When entering the information for the contact person, be sure to provide the name and phone number of the person to be contacted regarding questions related to the survey form. Having the correct agency contact facilitates the contact process should questions or concerns arise related to the survey and responses provided. The form does have validation and ensures that a 10-digit phone number is entered and that the email address is of a valid email format, such that it includes an @ sign and a period followed by 2 or 3 letters. Please make note of the provided definition of a warm handoff here at the survey open. With the impact of COVID and continued review of warm handoff processes, this definition has continued to adapt to reflect the efforts of the warm handoff community. Specifically, warm handoffs are no longer required to be face-to-face encounters, nor are they limited to only door-to-door referrals. This latter change reflects a change in response to SCA communication requesting more recognition for referrals into various treatment services that weren't necessarily door-to-door. DDAP considers these referrals just as valid and critical as their door-to-door counterparts towards recovery. Selecting your SCA causes the section entitled Hospital Information to populate with information from the Department of Health regarding the count of hospitals, the hospital names, and the hospital addresses determined by the county of the hospital. In this image, I've chosen Beaver as my SCA from the dropdown, and the data behind the survey identifies that there is a single or one hospital in this SCA and pulls in the name and address of the hospital, as well as the most recently reported models and shifts of warm handoffs at the facility. Please always review this information and note any changes requested in the comments field at the end of the form. New facilities will have shifts and models denoted as not yet reported to DDAP and will be prompted with questions regarding the models and shifts available at the hospital. For each hospital, the SCA must indicate whether warm handoff encounters were conducted anywhere in the hospital, whether that is within the ED or outside the ED. If a new hospital opens or a listed hospital closes within the SCA, please also note that as a change request in the final comments field. DDAP and I review the request and make the appropriate changes in the background information file for the next month's form, or we'll reach out to the provided contact for additional discussion. Please make note that the downward-facing triangle to the left of hospital information will collapse this section of questions. You do not want to have this section collapsed and minimized, so if you do happen to click that triangle, click it again to expand the question group once more. Throughout the survey, definitions and examples are provided alongside their relevant questions in order to reduce misinterpretation and add clarity. You can see the definition of a warm handoff again defined here for the first hospital question. A response indicating that warm handoff encounters were conducted prompts additional questions regarding those encounters on the form. If warm handoff was conducted at this identified hospital, it is necessary to report the total number of warm handoff encounters within the hospital's emergency department, always denoted in red text. DDAP requests how many of the encounters were conducted via telephone and via telephone without any face-to-face interaction, even if it is digital interaction, and done via telephone for any reason, not just due to COVID concerns. There are validation checks in place that will prevent the number of telephone encounters from exceeding the total number of encounters reported. You are then asked for detailed counts on the outcome of the reported encounters. How many were successful and how many were a refusal. The formerly used incomplete status outcome has been removed. Referrals and refusals are defined with their relevant question, and these are required items, meaning that blank responses are not acceptable. So please enter 0 where applicable. There is a quick read-only validation check that totals your entered responses of referrals and refusals and verifies that that total matches the number initially reported as occurring in the ED. If this sum is differing from the number reported as occurring, you will not be able to submit the form. You must change the number of referrals or refusals and exit that response field to get this read-only check to update and confirm validation. When your total reported count is equal to your detailed outcome count, you are able to proceed. Your response regarding the count of refusal outcomes may cause additional questions to appear. Reporting any number of refusals prompts a question asking for the reasons behind the refusals. Respondents can select any number of reasons and can specify other reasons for refusal by selecting the other response option, but upon doing so, will be required to provide an explanation in the text field. A new question item for the 2022 version of the collection form involves reporting a breakdown of the treatment services referred to for successful referrals. The number of reported referrals is pulled into the question text for reference. Here it is 80. One warm handoff encounter may result in referrals across the categories of services provided: inpatient, outpatient/IOP/partial, recovery support/case management, and medication-assisted treatment. Increment a category if the encounter resulted in referral for that category. Since one encounter may result in multiple referrals across these categories, the total sum of these 4 categories will likely exceed the reported number of encounters resulting in referral, but each single category should not exceed the number of reported encounters resulting in referral. Please note that this section does have a triangle that will collapse the section of questions, and you again do not want to have questions collapsed. If you accidentally click the triangle arrow, click it again to expand the questions once more. Following the referral categories, a question regarding the impact of the lack of treatment capacity has been added to measure the number of delayed referrals. Following this, in measuring if WHO processes have expanded beyond overdose patients, a question asking for the number of encounters resulting from reasons other than overdose is required. DDAP has been collecting data that goes beyond the initial opioid overdoses that were included in warm handoff and have expanded into other substances. This expansion has been more inclusive and encompassing and provides a mechanism to analyze additional substances involved in warm handoff encounters. The next question series: how many of your WHO encounters with this hospital emergency department did you respond to for the following substances? Is to capture the number of WHO encounters related to each substance category. Individual substance items used in DDAP reporting and that provided to SAMHSA via the TEDS dataset have been grouped into larger categories. Enter a numerical response for the number of encounters for each drug category. If the response is none for that drug category, then a 0 should be entered, as these are required items needing a response. In those instances where an individual may present with polysubstance use across multiple categories, the SCA should count the encounter for all relevant drug categories. That is, again, individual drug categories will be less than or equal to the number of encounters reported, but the sum of the values of the categories will likely exceed the number of encounters reported due to polysubstance use reporting. This section also has a collapsed triangle that you can toggle to make sure you have expanded questions. DDAP is not only interested in warm handoffs occurring inside hospital emergency departments now, however. DDAP includes questions regarding warm handoffs occurring in hospital areas other than the ED and will be denoted as blue text throughout the survey form. This question is prompted for each hospital reporting WHO encounters occurring for the month. Within the current hospital were warm handoff encounters conducted in hospital areas other than the emergency department. This question requires a yes/no response, and that response will cause additional questions to appear. This question allows an analysis of hospitals with WHO engagement throughout other areas of the hospital. For one hospital in SCA, WHO may only be conducted in the emergency department. For another of SCA's hospitals, they may have WHO throughout the hospital. Examples of other areas other than the emergency department where warm handoff encounters may be conducted include, but are not limited to, medical or surgical units, labor and delivery units, and behavioral health units. Respondents can identify these areas in the final comments of the form if they desire. For hospitals indicating warm handoff outside the ED, questions from the ED line of questioning are mirrored for these expanded WHO areas. You'll be again asked for the total number of encounters, the number of encounters conducted via telephone, and the number of successful referrals, and the number of refusals. Again, a validation read-only check question appears to make sure everything tallies out. The outside the ED question track also mirrors the new question item for 2022 involving reporting a breakdown of treatment services referred to for successful referrals. Again, increment a category if the encounter results in a referral for that category. One encounter may result in multiple referrals across these categories. So the sum of the categories will likely exceed the number of encounters reported, but each individual category should not exceed that value. This section, again, contains a collapsible triangle, so please be sure to have question items expanded upon submission. Questions regarding the impact of the lack of treatment capacity and the number of encounters resulting from reasons other than overdose follow the referral categories once again. This allows for comparison against those presenting in the ED reported substances corresponding to WHO outside the ED also continues to be collected. The categories are identical to those previously collected on the emergency department track. If the response is none for that drug category, enter a 0 as these are required items. In those instances where an individual may present with polysubstance use across multiple categories, the SCA should again count the encounter for all relevant drug categories. This once again makes the sum of categories likely to exceed the number of reported encounters, but each individual category should not exceed the number of encounters. Once again, as a group of questions, there is a collapsible downward facing triangle. If you accidentally toggle it, be sure to retoggle it so that the questions are expanded and visible. That then completes the set of questions you might encounter for a single hospital in your SCA. If there are additional hospitals identified as located in the SCA, you will need to navigate to the next hospital record by clicking the right gray arrow within the form, and then continue to indicate if that second hospital conducted warm handoff encounters. We are depicted here at hospital 1 of 19 and would click that right arrow to advance to hospital number 2. If you have completed the series of questions for all hospitals in your SCA, hospital 19 of 19, you can then proceed and add any additional notes and comments in the final field. This is where requests for changes to hospital information that's pre-populated should be noted. For example, the SCA may note the inclusion of a hospital in the WHO process and provide their name and address for update, or they may denote a change to the shifts that warm handoff encounters are conducted at a hospital already in the form, or they might suggest they are utilizing a new warm handoff model type in addition to those already attached to their previous submissions. If these or other specific edits are noted in the comment field, DDAP and I will follow up with the form contact if necessary and make the requested modifications available for the next month's survey form. Clicking the check mark in the lower right will prepare your form for submission and should only be done after you have completed the information for your final hospital in your SCA. The application will do a final validation check of your responses. Pop-ups for responses flagged as invalid may appear, and they will direct you to the survey questions violating these validation checks. If it is found that all your responses are valid, you will instead be directed to the survey completed pop-up screen. survey completed screen indicates that you are validated and ready to submit, and will check if your device is connected online and able to actually transfer your data. When you are connected and online, select the middle option of Send Now, and the data is submitted to DDAP, and a copy of your responses will be saved in the Sent storage area on the collection forms navigation screen within your device's application. So long as that survey remains on your device, you can always review the submitted form within your completed fields by clicking the Sent box in the collection forms navigation area. Selecting Send Later will send a copy of your form to the Outbox storage area on the collection form navigation screen. This should be the lesser used option and should be used when you have completed the form but are not yet ready to send it, such as cases where you may not have data connection to send data, or you need to double check and confirm and enter a response before submission. Selecting Send Later does not send the data to DDAP. Instead, the form can be opened from the outbox on your side as a respondent and completed later, and then sent with the Send Now option upon final completion. Essentially, when you are satisfied with your data entry and are able to submit, be sure to use the middle Send Now option to send the data to DDAP. Should you wish to verify a successful submission of the form to DDAP, you can email the DDAP resource account and request that verification.
Thank you, Ralph, for the walkthrough of the Warm Handoff survey. Please remember that these changes do not go into effect until January 2022 and will not show up on your survey until we send out the survey link in February 2022. This means that until the changes go into effect, we still want you to continue to report any warm handoff encounters the same way that you have been doing for the past several months. Questions regarding the warm handoff survey or this training may be sent to the email resource account. Please include Warm Handoff Report in the subject line of all inquiries submitted. The link to this training and other resources for Warm Handoff will also be on the DDAP website. Thank you to all of the SCAs and others involved in the Warm Handoff survey process and for attending this webinar. Have a great day, everyone, and this concludes our training for today.